get depressed. When this substance or this chemical goes down, then the patient have the symptoms of depression. And when we give medications, when I give medications to my patients, I say there is a chemical in your brain that's called serotonin, and this medication is to correct that chemical deficit in your mind, in your brain. And with time, usually patients pick up and, the depression is treated.
So sometimes, people are depressed, like you said, that they have a disorder with eating. They start to eat too much or they don't eat at all. So with this medication, they will stop eating if they are eating too much?
Yes. If they have poor appetite, their appetite will go back to normal. If they have increased appetite because of the depression, their appetite also will go. We would like to take the patient to their baseline, where they were before they were depressed. So, yeah, it corrects both ways. Same thing with the sleep. If the sleep was decreased, it should go back to normal. And if it was increased, it should also go back to normal.
So, I mean, if those medications are prescribed medicine or on counter? Or?
No, no, they are prescribed medication.
For how long do you prescribe this medication? What is the duration for this medication?
Okay, that's a very good question. I always explain to my patients that you don't take this medication for a week or two or a month or two. We're talking from 6 months to 1 year. And the studies and the literature and the research are all inclined towards the 1 year mark. Even they are saying now 1 to 2 years. The idea, Ahmed, is that the longer we keep the person healthy, not depressed, that we are more stabilizing the chemical at the brain level. The longer we stabilize, the better the outcome at the end. So I tell this to my patients so that they don't expect that after a month or two I'll stop the medication. Some patients do that. They feel better after 2 months and they stop. And they come to me after some time depressed because they did not consult me before stopping the medication. So usually 6 months to 1 year, maybe 1 to 2 years.
Well, this medication, no side effects for this medication?
All medications have side effects, okay? But there are medications, newer medications that are coming that have better side effect profile. The old medications, old antidepressants have many side effects and really used to make life difficult for patients because they will cause dry mouth, blurred vision, constipation, drowsiness, sedation. But the new generation antidepressants are better in that they don't have these side effects. So what do they have? Most of these medications, unfortunately, have this symptom or side effect of weight gain. So that's the one thing I warn my patient about. Some of them are initially sedating, which means the patient feels a bit drowsy. But they are basically safe on the heart, on the kidney, on the lungs, on the abdomen, on the body as a whole. It's safe. It doesn't cause any harm. They don't cause any harm to the body organs. So they mostly, weight gain sometimes. Apart from that, they are safe, very safe medications.
We had received a phone call from a lady called Manar, and she was asking about, again, the reason of depression. And she said, if we have a daily problem, for instance, I have a problem with my husband, a problem with my kids, a problem with my boss in the work, would this also consider depression? Daily problems.
Okay. Stress at work can, if it is continuous and if it is causing the morale of the person to be, low, then maybe, day after day of stress will end up in causing depression. But it depends on the person. Some people can cope well with stress. Some people are doing very stressful jobs, but they are functioning, they are fine. But other people can't tolerate the stress and they can end up being depressed. So, yes, it is potentially there is a possibility that depression might develop after chronic stress.
How can I stop depression from the beginning, doctor? I mean, it will not lead into a bigger one.
Okay, the best thing is that we need to inform and maybe probably educate, the people about depression, about psychiatric disorders, so that this is number one, and this is key. If people know about what is depression, then they can say, I think I am depressed. Let me go and see the doctor. Okay. If there is, like I said, if there is a family history, if someone's father has depression or mother has depression, they will be at risk of developing depression. So these individuals need to be aware. So if at some point they notice that they are not like what they used to be, that they are not functioning as well as they used to be, they are not sleeping, not eating, all these symptoms, then they need, to see someone for a consult. Just go and ask for a consult. If the doctor tells you you're fine, then you're fine. If it says this is depression, you need treatment, then they should. So catching the disease early or the disorder early is the best thing someone can do to himself.
Okay, doctor. We have a phone call from Fatma. Fatma, go ahead.
Hello.
Yes?
Good evening for both of you, and thanks you a lot for this very useful program.
Appreciate
I wish that
coming.
you do a lot of programs like this, because it's for the benefits of the, especially the one that they don't go to the clinics of the doctors.
Thank you.
Yes, fine.
Excuse me, doctor. I have a problem. I'm 30 years old. Are you with me?
Yes, I'm listening. Go ahead.
I face a lot of problems since I was 18, but my kind of personality that I don't look back. It means that I go ahead with my life. I finished my study and I start work, and I have my own small family, and everything seems to be okay.
Okay.
But now I feel that the problems that I used to have before, now it's coming back to me.
So what are the difficulties you're having right now, Fatma?
The things that I thought I know it was very easy, now it becomes like difficult problems to me. I used to think of the past a lot. And
no, what areas that you are not functioning well right now in your life?
Yeah, and I seem to judge myself too much. I used to have very self-confidence. Now it's not. I don't know, like if it was the result of the past coming back to me now.
Yes, okay.
So even my personality, I hesitate a lot, and I don't know what to do in some certain circumstances. Sometimes even I have lack of sleep, and I don't even face people a lot, not like before.
Okay.
So I don't have the time to go to clinic to see a psychiatrist or
a psychologist.
Sorry,
yes.
But,
yes.
Yeah, but what could you advise me at least to do for the future?
Okay.
Thank you.
Yes, okay, Fatma. Well, thank you for your question. Actually, what Fatma described is not unusual. It happens that people in their maybe early life, they have some kind of difficulties, and they overcome these difficulties. Then, as Fatma was describing, carries on with her life, gets married, and maybe even have a family. But after that time settles, things come back from earlier years. Now, I'm not exactly sure whether Fatma is having just personal difficulties or things that are related to depression, because depression can also make people hesitant. They can't make up their mind. They have difficulty making decisions. They can't concentrate. They blame themselves. They feel guilty. This is also other aspects of depression. So, Fatma, unfortunately, if you don't have the time to go and see someone, you need to see someone, because to decide whether this is something that can be touched by therapy alone, or maybe there is need for medication, if there is evidence that you have depression. So unfortunately, because of the time limit, I can't spend too much time asking Fatma over the phone what are her symptoms. The bottom line is that you will need to see someone for a consult, and I suggest that you go to someone who's professional, because there are some people who claim to be professionals and they are not professionals. So go to seek professional help from someone that it gets recommended to you, and then follow their advice.
She can come and visit you in the clinic, in the
Sure,
hospital.
by all means.
Yes,
Yeah.
if you have. What time you have? Every day you are there, or?
I'm in the hospital every day except for Wednesday. I go to Amiri Hospital on Wednesdays because I have a child psychiatry clinic. So for the first 4 days of the week I see adults, and on Wednesdays I see children.
Okay, she can come and contact you there.
Yeah.
Before I introduce my next caller, there is a lady called Aida. If you please call us again, because we lost your phone number. Also, I'd like to thank Fatma for her comments regarding this show, and that's why we make this show. We bring the doctor and to answer your questions, and if we have also email and a fax number, if later on, if you want to contact the doctor, we can refer your questions to him later on.
Sure.
We have Asma. Okay, again, we'll put the email now. It's health and fitness .gov. Yes. No, it's not this one. Doctor, no, this is the next one. Our email is healthandfitness.gov.kw. We have Aida now, or Asma? Okay, we have Asma. Asma, go ahead.
Yes, hello?
Hello,
yes, Asma.
Hello,
Go ahead.
Asma. Good evening to you.
Excuse me, doctor. I just wanted to ask, and I think my question is the same of the previous caller.
I see. Yes.
I think I have this. I think it's a problem, because I cannot, if I have a job to do or something like a project or in my study or in my relations, I cannot continue in any, and I renew them, even my friends or even my life. Do you think this is a problem or something? I cannot perform my work and give it to my doctors or professors in college.
I always ask Asma, when I see my patient, I always ask, has there been a change in your function? What is the cutoff line? Were you functioning well at some point and now you are unable to function?
Yes. After I finished high school, I was doing well. But then I suddenly felt everything I have to do it perfect.
I see.
If it's not perfect, I cannot give it.
Okay.
That's why. Is this a problem or something?
Okay. All right. Okay.
Go ahead.
So maybe the point is about perfectionist people. There are people who have, by their nature that they are perfectionist. And maybe, I'm saying maybe Asma is one of them. Because she describes very nicely by saying that if she doesn't do it properly, she will not do it. And this is what happens with people who are perfectionists. They delay their work because they think, because of fear that the work might not be perfect or proper. And perfectionist people, unfortunately, have increased risk also of depression. You see, we are talking a lot about depression today. Why, Ahmed, they have this issue? I mean, they are perfectionists. What's got to do with depression? Because they always have high standard, and they feel that they can't meet these standards. And maybe Asma is one of them. She puts high standards, she wants everything perfect, and if it's not perfect, I will not do it. So what will happen naturally? She will fail, she will feel she is not functioning, she is not achieving, and she's, not getting forward, and feels that, I'm worthless, I can't do anything, and feels depressed. So unfortunately, people who have these perfectionistic traits can also end up in depression. Not everyone, I'm saying, but they are at risk of developing depression. So again, Asma, my advice to you is that you'll also need to consult with someone to talk about whether these are traits that maybe you can talk about them, or maybe at some point you really develop